Hello and welcome to another live stream of Dr. Barbara Miller's comprehensive NCLEX review. The topic that we want to discuss today is on types of dialysis that you should know. It should become part of the topic in your preparation to be effective on your State Board of Nursing examination. So, what is dialysis? Dialysis is an artificial process of removing waste product and excess fluid from the body when the kidney no longer function adequately. Failure to do so, it could cause death on that patient. You do have two types of dialysis, and we're going to discuss both types. You have hemodialysis, where you could get it in centers, and also at home. You have peritoneal dialysis, where that could be done at home or a particular center. Patient with kidney or kidney failure may need to go to dialysis when they have very high levels of potassium and calcium in the blood. If they are in uremic or experiencing uremic encephalopathy. And what is that? It's a severe brain disorder caused by kidney failure. It could cause patient to have mild fatigue to seizure and coma. Okay, when patient also has pericarditis, when patient has acidosis, patient is in heart failure with excessive accumulation of fluid, patient experiencing symptoms of renal failure when they go through all 5 stages. They're now at the 5th stage. Pulmonary edema, they're not able to breathe due to accumulation of fluids. And also when their glomerular filtration rate is less than 10 to 15 milliliters per minute. So the goal of dialysis, what is the main goal? Is to decrease the waste in the blood, the toxic waste that build up in the blood, correct acidosis, reverse any electrolyte imbalances, and remove excessive fluid, because that could cause the patient not to breathe adequately. You have 2 other ways to filter blood: hemofiltration. And what is a hemofiltration? That is done in the intensive care unit setting as a continuous procedure that can filter large amount of blood. And another way is hemoperfusion. Okay, hemoperfusion used to treat patients who get poisoned. The charcoal filtered to absorb that poison. So let's talk about hemodialysis. Hemodialysis is one of the most common type of dialysis, and effective dialysis. Blood removed from the body and pumped into a dialyzer or an artificial kidney, which then filters metabolic waste, electrolytes, and fluids. Then the blood returned purified. They could manage the total amount of fluid return by adjusting that fluid. So hemodialysis has to be done 3 times per week at least 3 to 5 hours, and what they're looking for, clearance. Okay? This can be done, as mentioned before, at home. Okay? So, what are the complications of hemodialysis? Decrease in the blood pressures. So, before the patient gets started, patient must be weighed. Patient must you must check the vital signs, more so the patient's blood pressure. So complications of hemodialysis is decrease in the blood pressure, and that could cause the patient to go into cardiac arrest. Okay? Decrease in blood pressure is the most common. Infection of the graft or the fistula, and we're going to talk about the different types of fistula that you should be mindful that they utilize that to give hemodialysis. What other complications of hemodialysis? Fever. Patient could have anaphylaxis. And why is that? They could be allergic to the substance in the dialyzer or the tubing. They also could have dysrhythmias, okay, air embolism, bleeding in the intestine, the brain, the eye, or the abdomen. And why is that? Possibly too much heparin in the dialyzer. Heparin must be in the dialyzer, and if it's too much, it could cause major complications with that patient. So you're to know the different access that they use for hemodialysis. External shunt catheter, and that's where they put place is a cannula placed in the large vein and the large artery, each near each other for immediate use. That's external shunt catheter. And this is usually utilized on a short-term basis, okay, because it places the patient at a high risk for infection, clotting, and skin erosion. Another form of venous access is arteriovenous fistula. This is where the large artery and the vein, the anastomose, tied together or sewed together, that creates one blood vessels, okay, for both withdrawal and return. Just be mindful that all these has to be done surgically. So arteriovenous fistula requires surgery, and the healing time is up to 6 weeks. They will ask patient each time to use a ball and press on that ball to help to develop that AV fistula. The bigger the site, the better it is. Then you have your arteriovenous graft. This used as a synthetic connector to connect artery and vein. It almost creates one blood vessel for both withdrawal and return. This also requires surgical procedure, and the healing time is up to 2 months. You got to be mindful with these patients when they are done with the dialysis. You want to explain to the patient, try not to use that arm, okay, or try not to bump that arm, because these venous access could open up and cause havoc. Patient could bleed to death or bleed to death. Okay, if they're home, dropped off at home, and they are alone. So you want to tell them to ensure that that site is wrapped, and they should not use that site. Also, the nurses and nursing students should know that they should not use the venous access site to obtain blood pressures. They should do it on the other arm. So that's hemodialysis. Then we're going to talk a bit about peritoneal dialysis. And what is that? This dialysis is used the peritoneum, okay, and that's the lining of the abdominal cavity to act as a natural filter, okay, and this is also surgery to replace the dialyzers, and we're going to talk more about the different types. Fluid dialysate infused through the catheter into the peritoneal or peritoneal space. The dialyzer sits for a period of time. It absorbs the waste products, the electrolytes, and then it is drained and discarded. Remember, peritoneal dialysis is done at least 4 to 5 times per day. Patients should not skip any of those sessions. This should be done under sterile technique to prevent infection, and we're going to talk about the complications of peritoneal dialysis. So they use osmosis dialysis as an increase in concentration of glucose attracting fluid. More fluid is drained than was instilled. Just be mindful that peritoneal dialysis is less efficient than hemodialysis, but it can run for longer times. Okay, the peritoneal dialysis is not the same as the hemodialysis, because the hemodialysis is more effective than the peritoneal dialysis. So types of peritoneal dialysis is continuous ambulatory peritoneal dialysis, or CAP. C as in Charlie, A as in Apple, P as in Paul, D as in David. This is manually done throughout the day to maintain more flexibility schedule for that patient. Another type of peritoneal dialysis is automated peritoneal dialysis. This uses a machine to perform the exchange automatically as patients sleep. So this more done at nighttime. So peritoneal dialysis, there are 2 types: continuous ambulatory peritoneal dialysis, which done throughout the day. Remember, peritoneal dialysis must be done 4 to 5 times per day. Hemodialysis done 3 times per week, at least 3 to 5 hours. Sometimes it may be longer than 5 hours because they're looking for adequate clearance. So types of peritoneal: continuous ambulatory peritoneal dialysis and automated peritoneal dialysis, which is done at nights. The patient could be on that throughout the night. So what are the complications of peritoneal dialysis? Can decrease in blood pressures, bleeding, irritation of the peritoneum or peritoneum, infection at the insertion site. Patient will have low albumin or hypoalbuminemia. They also will have scarring of the peritoneum. They can develop abdominal and groin abscess. And remember, patient may need a stool softener because constipation interferes with the dialysis flow for peritoneal dialysis and hemodialysis. The diet, let's do the intervention for peritoneal dialysis. Remember, you're going to assist the client to void prior to the procedure. You want to weigh the client daily. You want to monitor the same as hemodialysis. You want to monitor their vital signs, and you want to look at their labs, their electrolyte, to see if there's any imbalances. This must be done under sterile technique because you do not want to introduce any infection process to that patient. And you want to keep accurate records of the client fluid balance. With peritoneal dialysis, you want to ensure that the dialysis plate is warm, 1 to 2 liters. You want to allow to flow in gravity. Gravity going to make that happen. 5 to 10 inflow time close to the clamp immediately. 30 minutes of equilibrium, that's dwell time, and 10 to 30 minutes of drainage. It should be clear and pale yellow. You want to monitor for complications of peritoneal dialysis. And one of the major complications is peritonitis. Peritonitis is very painful. Patient will have severe abdominal pain, okay, bleeding, respiratory difficulty, and possible bowel or bladder perforation. So what are the complications of peritoneal dialysis? Peritonitis, and I'm just repeating, it can be life-threatening situation. Patient needs to be in the ICU because the pain is so severe. They could also have bleeding, respiratory difficulties, abdominal pain, and bowel or bladder perforation. So what's the diet for peritoneal dialysis? Adequate protein and calcium, low to no salt. Sodium causes retention of fluid, so you got to be mindful of that. Diet for hemodialysis is sodium and potassium restriction. Phosphorus, they could get a little bit of phosphorus, but it's limited, like foods that high in phosphorus, okay? It's limited. I want to go over the 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 type of catheter used for peritoneal dialysis. That also is done surgically. You have 3 different catheters that you should have some knowledge on in the event that question arise on your State Board of Nursing exam. The first one is tense cough. And I'm going to say it out. T as in Tom, E as in Edwards, C as in Charlie, K as in kite, H as in Harry, O as in orange, F as in Frank, F as in Frank. Tense cough catheter. This is the most common used peritoneal catheter, and they will do a surgical procedure to insert this catheter. Then you have the swan neck catheter. It has an inverted U-shape arc between the deep and superficial cuffs, and the Toronto Western Hospital catheter, TWH, T as in Tom, W as in work, H as in Harry catheter. This type has a silicone disc perpendicular to the catheter. So you're to go over the 3 types of catheter that they utilize for peritoneal dialysis. Tenchkoff, Swan Neck, and the Toronto Western Hospital catheters. Remember, peritoneal dialysis patient at risk for peritonitis, which can be very life-threatening because the patient has excruciating abdominal pains. Let's reiterate, hemodialysis, you want to assess the patient AV fistula site, and what you're looking for, a bruit, you're going to listen for a bruit, and you want to feel the trill. So you want to assess the AV fistula for bruit and trills. You want to hold any type of antihypertensive medication before dialysis. You want to monitor the blood pressures throughout the day for hypotension, and you want to monitor the site for bleeding. Remember, following the dialysis, the fistula or the graft or the shunt has to be wrapped nicely to prevent the patient bumping into something which could cause excessive bleeding. Then your peritoneal dialysis, you want to monitor for signs of peritonitis. And how are you going to monitor? You want to look at the fluid. If the fluid is cloudy, the outflow is cloudy, patient might start complaining of abdominal pain. You know that is a signs of peritonitis, and you need to report that immediately to the healthcare provider. For peritoneal dialysis, you want to maintain sterile technique. You want to warm the dialysis site before infusion, and the material that passes, what is the dialysis dialysate. That's the material that passes through the membrane in the dialysis. Are there any questions on dialysis? Please journal your notes, okay? When you journal your notes, it is better for you to remember, okay, the content. As mentioned before, content is paramount. When you know your content, no matter how the question comes, whether it's in a case study, whether it's fill in the blank, whether it is a multiple choice or select all that applies, you will be able to decipher the correct choice. Thank you for watching this video, or not video, the live stream. There's more to come. Tomorrow I will talk about chest tube. Thank you so much. Are there any questions? As mentioned before, if there's any questions and you're not able to say it on the live, you could send a text to the community response site, and I will get back to you. Thank you so much, and I will see you all tomorrow morning at the same time. Thank you.